This is the introduction to the physical therapy chapter. As a medical assistant, you're going to learn about applying hot and cold packs, assisting with ambulation or walking, teaching basic exercises. We will talk in class about how to use a cane, walker, crutches, and a wheelchair. And you will discuss with the patient specific therapies for at-home use. Physical therapy. Okay, number one, what is it? Of course, it's used to treat all sorts of disorders, primarily musculoskeletal disorders, so post-surgeries, post-accidents. It can be used to treat certain nervous system disorders, okay, such as after a stroke or a spinal cord injury. And for cardiopulmonary disorders, so after a heart attack, in order to regain function, they often go to see a physical therapist. We again will talk about different treatments, benefits, and some of the more specific disorders that go along with this physical therapy chapter. As a team member with a physical therapy team, you would be considered a therapeutic team member. Some of your job responsibilities would include coordinating the patient's schedules, making any outside referrals as needed, of course documenting your findings in your electronic health records, teaching our patients with instructions and patient education, and of course answering questions for our patients. First thing we want to talk about is a test we call range of motion. It is often abbreviated ROM. And what we're talking about is just how much can a joint move, okay? So I mean, how far can you bend your knee? How wide can you put your shoulder in all different directions? And what we're looking for really is that they match from one side to the other. So the right side should be the same as the left. And if they're not, then we are certainly looking for a problem in the side that does not move. Also, we have a standard to compare these two. So there are plenty of charts out there, and they do go by gender and by age group. And there should be a certain amount that somebody can say, turn their head to the right and left. Okay, look up or look down. Okay, to hold their arm out to their side. Okay, there's standard measurements that are considered normal. All right, the tool that we use to do this is something we call a goniometer, and it looks like a protractor from way back when you were in school, and I will show you an example of one of these when you come into class next time. Another thing you might do to assess your patient is looking at their muscle strength. Again, you're comparing rights to lefts, and they'll look through a wide range. You know, can the patient walk, pull themselves up? Okay, do they have normal muscle tone from one side to the next? Another thing they might look at is something we call gait. And gait really is just looking at how a patient walks. And if you've ever sort of noticed how a patient walks down the hall, it should look even again from right to left-hand side. There should be no obvious limping or movements, and they should look like they're walking smoothly. The last thing they're looking at is posture. You know, does the patient stand right? Again, we're looking for right to left sides. We talk about things like scoliosis, right? The spinal cord becomes almost S-shaped if you're looking from the back. And again, you're just looking for, you know, does the right side match the left? Is one shoulder higher than the other? Okay, do the hips have the same height? Okay, so they may just look at, you know, how does the patient hold themselves and is it in a normal position? The next thing we're going to talk about is cryotherapy and thermotherapy. And essentially what we're talking about here is cryotherapy is using cold and thermotherapy is using heat. There are different types that we'll see in a few moments. However, there is a link inside your physical therapy folder. It will take you out to the Cleveland Clinic site, and there is a nice infographic picture that sort of breaks down why we would use cold therapy versus heat therapy. And this is one of the questions that you are to answer for your homework. All right, so why might we use cold? Why might we use heat? There's a general rule, of course there's always a few exceptions, that if something is exceptionally swollen or is acute, meaning that it's been less than 3 days since the actual injury, we like to use ice. And if the injury is more muscular, has been more than 72 hours or 3 days, we generally choose heat. Patients' age and general health are certainly going to affect some of the things that we choose. Some of the things you should be aware of are something we call contraindications. Okay, a contraindication means a reason that we wouldn't use a particular therapy. I have included a chart inside your notes that you can use to reference when we might not use cold or hot therapy, but for cold therapy, if a patient has problem with circulation already, you would not want to use ice. Okay, it tends to make the blood vessel smaller or to constrict, and it would only make that problem worse. Of course, for either hot or cold therapy, if they couldn't tolerate the actual heat pack or cold pack being placed onto their skin, you would not use that. And if it creates burns, okay, of any sort, of course, we would not want to place this on our patient's skin. And for heat packs, okay, we do not place these over cancers or what we call malignancies. And you would never place them over hemorrhages, so excessive bleeding. Again, that would open up the blood vessels and create more bleeding. Treatment location, of course, is where we'd like for that hot or that cold to go. If a patient has circulation impairment, meaning their circulation is not good to an area, we should certainly not use either. If they have an area where they can't feel anything on their skin, or what we call sensation impairment, you should not use cold or hot packs because they will not be able to tell you if it's creating a burn or a problem. If they can't tolerate the temperature, whether it's cold or hot, and be aware that elderly people, because their skin is a little bit thinner, okay, than other adults, they tend to be a little bit more sensitive to the cold and the heat. And there should be some extra towels, layers, or packaging, okay, that go between the cold or the heat pack and your patient's skin. All right, let's first talk about cryotherapy or cold. Okay, some of what it does is that it constricts or makes the blood vessels smaller. Okay, so it's going to help prevent swelling, okay, decrease bleeding, because if our blood vessels are smaller, less blood can get to that area. It reduces inflammation, okay, wherever you place the cold pack. It works as an anesthesia, meaning it should numb the area, which should help to reduce pain. It reduces pus formation, and of course it lowers the body temperature. So if somebody is overly warm, okay, a cold pack would work. All right, we do have dry applications, okay, of cold therapies, and these would be your ice bags and your chemical ice packs, and that just means against the patient's skin it's dry. These are nice because it doesn't leave the patient with wet clothing. Okay, it's very easy to do inside the office and not sort of ruin any clothing for the patient. We do have wet applications such as cold compresses, so say a washcloth soaked in cold water, or actual ice being massaged against a particular body part. Okay, however, do realize that this wet and this cold portion does go right against the patient's skin. Okay, so this may create more problems for your patient. Heat, on the other hand, it does some of the opposite. So with cold, what we did was we constricted the blood vessels. With heat, we actually dilate or open up the blood vessels, and this creates erythema, which is a reddening of the skin. And just be careful that your patient doesn't get burned. However, it does help to relieve pain and congestion in the head. It helps to relieve muscle spasms and relax muscles. And if it's been past about 72 hours, it helps to reduce inflammation and swelling. For our dry heat therapies, again, it just means it's dry against the patient's skin. So these are your chemical hot packs, your heating pads, so the things that you plug into the wall and just turn up the heat. Hot water bottles because the water is inside and the wet does not touch the patient's skin. They make heat lamps, so literally it looks like a lamp. Okay, it generates heat. In fluidotherapy, these would be any sort of fluid inside a container that goes against the patient's skin. We do make some moist heat applications, so these would be things like hot soaks, whirlpool tubs, hot compresses, so washcloths soaked in water. And you could potentially alternate hot and cold packs, and that would be up to the physical therapist or the doctor's discretion. Paraffin baths are sort of interesting. They are wax, so they are very similar to what you do at the beauty salon. And that does really help to create a deep heat, okay, sensation underneath the skin, but again, you need to be concerned with burning. Last but not least, okay, is diathermy. And this comes in a couple different forms. It uses waves, okay, sound waves, to produce a deep heat. Okay, ultrasound, in addition to being able to generate a picture, okay, creates sound waves that heat the tissue very deeply. There are some other types, like shortwave and microwave types of diathermy. They just use a different wave. But this heat goes much deeper, okay, than any sort of hot compress or hot toweling to your patient's body. You do have to be careful with this because the heat does go deeper. Okay, there is a higher potential for burning.